Exam Cram NCLEX-PN practice questions. The nurse is caring for a client scheduled for removal of a pituitary tumor using the transsphenoidal approach. The nurse should be particularly alert to a. Nasal congestion, b. Abdominal tenderness, c. Muscle tetany, d. Oliguria. Nasal congestion. Why? Removal of the pituitary gland is usually done by transsphenoidal approach through the nose. Nasal congestion further interferes with the airway. A client with cancer is admitted to the oncology unit. Stat lab values Revel HGB 12.6, WBC 6500, K plus 1.9, uric acid 7.0, Na plus 136, and platelets 178,000. The nurse evaluates that the client is experiencing which of the following: a. Hypernatremia, b. Hypokalemia, c. myelosuppression, d. leukocytosis. b. Hypokalemia. Why? Hypokalemia is evident from the lab values listed. The other laboratory findings are within normal limits, making answers A, C, and D incorrect. A 24-year-old female client is scheduled for surgery in the morning. Which of the following is the primary responsibility of the nurse? A. Taking the vital signs, b. Obtaining the permit, c. Explaining the procedure, d. Checking the lab work. A. Taking the vital signs. Why? The primary responsibility of the nurse is to take the vital signs before any surgery. Answers B, C, and D are the responsibility of the doctor. The nurse is working in the emergency room when a client arrives with severe burns of the left arm, hands, face, and neck. Which action should receive priority? A. Starting ANAV. B. Applying oxygen. C. Obtaining blood gas. D. Medicating the client for pain. B. Applying oxygen. Which instructions should be given to the client? A. Rest in bed after taking the medication for at least 30 minutes. B. Avoid rapid movements after taking the medication. C. Take medication with water only. D. Allow at least 1 hour between taking the medicine and taking other medications. C. Take medication with water only. Why? Fosmax hold be taken with water only. The client should also remain upright for at least 30 minutes after taking the medication. The nurse is making initial rounds on a client with a C5 fracture and Crutchfield thongs. Which equipment should be kept at the bedside? A. A pair of forceps. B. A torque wrench. C. A pair of wire cutters. D. A screwdriver. B. A torque wrench. Why? A torque wrench is kept at the bedside to tighten and loosen the screws of Crutchfield tongs. This wrench controls the amount of pressure that is placed on the screws. An infant weighs 7 pounds at birth. The expected weight by 1 year should be A. 10 pounds. B. 12 pounds. C. 18 pounds. D. 21 pounds. D. 21 pounds. Why? A birth weight of 7 pounds would indicate 21 pounds in 1 year or triple his birth weight. A client is admitted with a Ewing sarcoma. Which symptoms would be expected due to this tumor's location? A. Hemiplegia. B. Aphasia. C. Nausea. D. Bone pain. D. Bone pain. Why? Sarcoma a type of bone cancer. Therefore, bone pain would be expected. The nurse is caring for a client with epilepsy who is being treated with carbamazepine tegretol. Which laboratory value might be indicate a serious side effect of this drug? A. Uric acid of 5 mg DL. B. Hematocrit of 33%. C. WBC 2000 per cubic millimeter. D. Platelets 150,000 per cubic millimeter. C. WBC 2000 per cubic millimeter. Why? Tegretol can suppress the bone marrow and decrease the white blood cells count. Thus, a lab value of WBC 2000 per cubic millimeter indicates side effects of the drug. A 6-month-old client is admitted with possible intussusception. Which question during the nursing history is least helpful in obtaining information regarding this diagnosis? A. Tell me about the pain. B. What does his vomit look like? C. Describe his usual diet. D. Have you noticed changes in his abdominal size? C. Describe his usual diet. Why? The least helpful questions are those describing his usual diet. B and D are useful in determining the extent of disease process and thus are incorrect. The nurse is assisting a client with diverticulosis to select appropriate foods. Which food should be avoided? A. Bran. B. Fresh peaches. C. Cucumber salad. D. Yeast rolls. C. Cucumber salad. Why? The client with diverticulitis should avoid foods with seeds. A client has rectal cancer and is scheduled for an abdominal perineal resection. What should be the priority nursing care during the post-op period? A. Teaching how to irrigate the ileostomy. B. Stopping electrolytes loss in the incisional area. C. Encouraging a high-fiber diet. D. Facilitating perineal wound drainage. D. Facilitating perineal wound drainage. Why? The client with a perineal resection will have a perineal incision. Drains will be used to facilitate wound drainage. This will help prevent infection of the surgical site. The client will not have an ileostomy. A. Roasted chicken. B. Noodles. C. Cooked broccoli. D. Custard. C. Cooked broccoli. Why? The client with diverticulitis should avoid eating foods that are gas-forming and that increase abdominal discomfort, such as cooked broccoli. The nurse is caring for a new mother. The mother asks why her baby has lost weight since he was born. The best explanation of the weight losses: the baby is dehydrated due to polyuria. B. The baby is hypoglycemic due to glucose. C. The baby is allergic to the formula the mother is giving him. D. The baby can lose up to 10% of weight due to meconium still, loss of extracellular fluid, and initiation of breastfeeding. D. The baby can lose up to 10% of weight due to meconium still, loss of extracellular fluid, and initiation of breastfeeding. Why? After birth, meconium stool, loss of extracellular fluid, and initiation of breastfeeding cause the infant to lose body mass. There is no evidence to indicate dehydration, hypoglycemia, or allergy to the infant formula. The nurse, if caring for a client with laryngeal cancer, which finding ascertained in the health history would not be common for this diagnosis. A. Foul breath. B. Dysphagia. C. Diarrhea. D. Chronic hiccups. C. Diarrhea. Why? Diarrhea not common in clients with mouth and throat cancer. A removal of the left lower lobe of the lung is performed on a client with lung cancer, which postoperative measure would usually be included. Closed chest drainage. B. A tracheostomy. C. A mediastinal tube. D. Percussion vibration and drainage. A closed chest drainage. Why? The client with a lung resection will have chest tubes and a drainage collection device. He probably will not have a tracheostomy or mediastinal tube, and he will not have an order for percussion, vibration, or drainage. 6 hours after birth, the infant is found to have an areas of swelling over the right parietal area that does not cross the suture line. The nurse should chart this finding as A. Cephalomatoma. B. Molding. C. Subdural hematoma. D. Caput succedaneum. A cephalomatoma. You cannot eat food prepared in a microwave. B. You should avoid moving the should on the side of the pacemaker site for 6 weeks. C. You should use your cell phone on your right side. D. You will not be able to fly on a commercial airliner with the defibrillator in place. C. You should use your cell phone on your right side. Why? The client with an internal defibrillator should learn to use any battery-operated machinery on the opposite side. He should also take his pulse rate and report dizziness or fainting. A client in the cardiac step-down unit requires suctioning for excess mucus secretions. The nurse should be most careful to monitor the client for which dysrhythmia during this procedure. A. Bradycardia. B. Tachycardia. C. Premature ventricular beats. D. Heart block. Bradycardia. Why? Suctioning can cause a vagal response and bradycardia. The nurse is caring for a client scheduled for a surgical repair of a saccular abdominal aortic aneurysm. Which assessment is most crucial during the preoperative period? A. Assessment of the client's level of anxiety. B. Evaluation of the client's exercise tolerance. C. Identification of peripheral pulses. D. Assessment of bowel sounds and activity. C. Identification of peripheral pulses. Why? The assessment that is most crucial to the client is identification of peripheral pulses because aorta is clammed during surgery. This decreases blood circulation to the kidneys and lower extremities. The nurse must also assess for the return of circulation to the lower extremities. A client with suspected renal disease is to undergo a renal biopsy. The nurse plans to include which statement in the teaching session? A. You will be sitting for the examination procedure. B. Portions of the procedure will cause pain or discomfort. C. You will be given some medication to anesthetize the area. D. You will not be able to drink fluids for 24 hours before the study. B. Portions of the procedure will cause pain or discomfort. Why? Portions of the exam are painful, especially when the sample is being withdrawn, so this should be included in the session with the client. The nurse is performing an assessment on a client with possible pernicious anemia. Which data would support this diagnosis? A. A weight loss of 10 pounds in 2 weeks. B. Complaints of numbness and tingling in the extremities. C. A red, beefy tongue. D. A hemoglobin level of 12.0 gm/dl. C. A red, beefy tongue. Wired. Beefy tongue is characteristic of a client with pernicious anemia. A client arrives in the emergency room with a possible fractured femur. The nurse should anticipate and order for A. Trendelenburg position. B. Ice to the entire extremity. C. Buck's traction. D. An abduction pillow. C. Buck's traction. Why? That client with a fractured femur will be placed in Buck's traction to realign the leg and decrease spasms and pain. A client with Kaner is to undergo an intravenous pyelogram. The nurse should force fluids 24 hours before the procedure. B. Ask the client to void immediately before the study. C. Hold medication that affects the central nervous system for 12 hours pre and post-test. D. Cover the client's reproductive organs with an X-ray shield. B. Ask the client to void immediately before the study. Why? That client having an intravenous pyelogram will have orders for laxatives of enemas, so asking the client to void before the test is in order. A full bladder or bowel can obscure the visualization of the kidney, ureters, and urethra. The nurse is caring for a client with a malignancy. The classification of the primary tumor is TIS. The nurse should plan care for a TUM or that cannot be assessed. B. That is in situ. C. With increasing lymph node involvement. D. With distant metastasis. D. That is in situ. Why? Cancer in situ means that the cancer is still localized in the primary site. Cancer is graded in terms of tumor, grade, node, involvement, and metastasis. A client is 2 days post-operative colon resection. After a coughing episode, the client's wound eviscerates. Which nursing action is most appropriate? A. Reinsert the protruding organ and cover with 4x4s. B. Cover the wound with a sterile 4x4 and ABD dressing. C. Cover the wound with a sterile saline-soaked dressing. D. Apply an abdominal binder and manual pressure to the wound. C. Cover the wound with a sterile saline-soaked dressing. Why? If client eviscerates, the abdominal content should be covered with a sterile saline-soaked dressing. The nurse is preparing a client for surgery. Which item is most important to remove before sending the client to surgery? A. Hearing aid. B. Contact lenses. C. Wedding ring. D. Artificial eye. B. Contact lenses. Why? It is most important to remove the contact lenses because leaving them in can lead to corneal drying, particularly with contact lenses that are not extended wear lenses. A. Call the surgeon and ask him or her to see the client to clarify the information. B. Explain the procedure and complications to the client. C. Check in the physician's progress notes to see if understanding has been documented. D. Check with the client's family to see if they understand the procedure fully. A. Call the surgeon and ask him or her to see the client to clarify the information. Why? It is the responsibility of the physician to explain and clarify the procedure to the client. When assessing a client for risk of hyperphosphatemia, which piece of information is most important for the nurse to obtain? A history of radiation treatment in the neck region. B. A history of recent orthopedic surgery. C. A history of minimal physical activity. D. A history of the client's food intake. A history of radiation treatment in the neck region. Why? Previous radiation to the neck might have damaged parathyroid glands, which are located on the thyroid gland and interfered with calcium and phosphorus regulation. A client is admitted to the acute care unit. Initial laboratory values reveal serum sodium of 170 mcV. What behavioral changes would be common for this client? A. Anger. B. Mania. C. Depression. D. Psychosis. B. Mania. Why? The client with serum sodium of 170 mg Val has hypernatremia and might exhibit manic behavior. The nurse is obtaining a history of an 80-year-old client. Which statement made by the client might indicate a possible fluid and electrolyte imbalance? My skin is always so dry. B. I often use laxatives for constipation. C. I have always liked to drink iced tea. D. I sometimes have a problem with dribbling urine. B. I often use laxatives for constipation. Why? Frequent use of laxatives can lead to diarrhea and electrolyte loss. A client visits the clinic after the death of a parent. Which statement made by the client's sister signifies abnormal grieving? My sister still has episodes of crying and it's been 3 months since daddy died. B. Sally seems to have forgotten the bad things that daddy did in his lifetime. C. She really had a hard time after daddy's funeral. She said that she had a sense of longing. D. Sally has not been sad at all by daddy's death. She acts like nothing has happened. D. Sally has not been sad at all by daddy's death. She acts like nothing has happened at all. Why? Abnormal grieving is exhibited by a lack of feeling sad. If the client's sister appears not to grieve, it might be abnormal grieving. This family member might be suppressing feelings of grief. The nurse recognizes that which of the following would be most appropriate to wear when providing direct care to a client with a cough. A. Mask. B. Gown. C. Gloves. D. Shoe covers. A. Mask. Why? If nurse is exposed to the client with a cough, the best item to wear is a mask. If the answer had included a mask, gloves, and a gown, all would be appropriate. The nurse is caring for a client with a diagnosis of hepatitis who is experiencing pruritus. Which would be the most appropriate nursing intervention? A. Suggest that the client take warm showers. B. IDB add baby oil to the client's bath water. C. Apply powder to the client's skin. D. Suggest a hot water rinse after bathing. B. Add baby oil to the client's bath water. Why? Oil can be applied to help with the dry skin and to decrease itching, so adding baby oil to bath water is soothing to the skin. A client with pancreatitis has been transferred to the intensive care unit. Which order would the nurse anticipate? A. Blood pressure every 15 minutes. B. Insertion of a Levine tube. C. Cardiac monitoring. D. Dressing changes to X per day. B. Insertion of a Levine tube. Why? The client with pancreatitis frequently has nausea and vomiting. Lavage is often used to decompress the stomach and rest the bowel, so the insertion of a Levine tube should be anticipated. The client is admitted to the unit after a cholecystectomy. Montgomery straps are utilized with this client. The nurse is aware that Montgomery straps are utilized on this client because A. The client is at risk for evisceration. B. The client will require frequent dressing changes. C. The straps provide support for drains that are inserted into the incision. D. No sutures or clips are used to secure the incision. B. The client will require frequent dressing changes. Why? Montgomery straps are used to secure dressing that require frequent dressing changes, because the client with a cholecystectomy usually has a large amount of drainage on the dressing. Montgomery straps are also used for clients who are allergic to several types of tape. The physician has ordered that the client's medication be administered intrathecally. The nurse is aware that the medications will be administered by which method? A. Intravenously. B. Rectally. C. Intramuscularly. D. Into the cerebrospinal fluid. D. Into the cerebrospinal fluid. Why? Intrathecal medications are administered into the cerebrospinal fluid. This method of administering medications is reserved for the client with metastasis, the client with chronic pain, or the client with cerebrospinal infections. Which client can be best assigned to the newly licensed to the practical nurse? A. The client receiving chemotherapy. B. The client post-coronary bypass. C. The client with a TURP. D. The client with diverticulitis. D. The client with diverticulitis. Why? TBIS client to assign to the newly licensed nurse is the most stable client. In this case, it's the client with diverticulitis. The nurse notes the patient care assistant looking through the personal items of the client with cancer. Which action should be taken by the RN? A. Notify the police department as a robbery. B. Report this behavior to the charge nurse. C. Monitor the situation and note whether any items are missing. D. Ignore the situation until items are reported missing. B. Report the behavior to the charge nurse. Why? The best action at this time is to report the incident to the charge nurse. Further action might be needed, but it should be determined by the charge nurse. The nurse overhears the patient care assistant speaking harshly to the client with dementia. The charge nurse would change the nursing assistant's assignment. B. Explore the interaction with the nursing assistant. C. Discuss the matter with the client's family. D. Initiate a group session with the nursing assistant. B. Explore the interaction with the nursing assistant. Why? The best action for the nurse to take is to explore the interaction with the nursing assistant. This will allow for clarification of the situation.